Yeah, good afternoon, everybody. 12:30 on this, I don't know, is it a lovely day, Dr. April, or not?
It's not too bad. It's not rainy.
Okay.
Correct.
It's not freezing.
We do have that.
Correct.
And it's not freezing, so we'll go with that, okay?
Yeah, we'll take it.
It's not the best of days, but it's okay. And it's always a great day when you are in the house.
I try to help you guys smile.
Thank you very much.
Oh, we do. It's our ray of sunshine.
That's right. We always just look forward to this. It's what we're going to talk about today and everything.
Yeah.
But I heard we're going to talk about pregnancy and postpartum, maybe?
Yes, you got it. Pregnancy and postpartum.
Wow, I can remember that. That's
Bingo.
Moms in childbearing years.
Yeah.
Yeah, and you're thinking, you want us to say, why? Why, pray tell, do you need to see women when they're pregnant and afterwards? Tell us why.
Yes. So during pregnancy, our body goes through a lot of changes, and I think a lot of women think it is normal to have pain during pregnancy. Sciatic pain, back pain, hip pain, pubic bone pain, pelvic
It's a lot
heaviness,
of pain right there.
Oh, there's a lot.
urinary leakage, all those things.
But that's not normal, right?
It's not normal. It may be common, but it is not normal, and pregnant moms should not have to live with that pain. So we often see moms starting in second trimester and honestly, we see moms who aren't even dealing with pain.
Okay.
Moms that just want to have the best pregnancy and labor and delivery and postpartum experience they can. So we work with all types of moms, from those having tailbone pain, sciatic issues, to those that are feeling great, but just want to be doing what they can for their body to help them with labor and delivery, reduce their risk of perineal tears, unneeded C-sections, things like that.
Okay, so there's lots of things to do on the pregnancy side of things. I mean, I've got a couple of kids, and you go through doing this stuff, and being that me and BD are not women,
Correct.
and are unable to have children. Were you surprised? I mean, you've had 15 kids now, or
I've
something
had
like
three.
that. Okay,
I've had 3 kids.
3 kids. Were you surprised with your body changes and stuff? And you're a person that knows about this stuff.
Yes, and so unfortunately for me, my pregnancies are not easy. Some women, love the feeling of being pregnant. They feel great. For me, each of my pregnancies, especially my third one, even, like I could feel it in my low back, my ribs, my pubic bone. So I myself was doing pelvic floor and obstetric physical therapy with Dr. Kyla at our clinic.
Yeah, very good.
Yeah, so I had to do my own rehab, and I also do it postpartum as well, because I want to have more children. I want to be able to feel well and not have issues. So I know addressing it during pregnancy and then immediately postpartum is super important. And I feel great now. And I want my next labor and delivery experience to be very well. I want to feel good during pregnancy. And you never know what the hormones are going to do and how your body's going to respond. Each pregnancy is different. But our goal is just to help mom feel well, especially once you've had a few kids. You're still taking care of your toddlers at home, giving kids baths, being active. And we want women to feel good and not have to be like and complain, my back hurts, my sciatic is really bothering me, I can't do that because of this. So yes, Dr. Katie, Dr. Kyla, and myself, we love working with this population. And we also don't want to hear women 20, 30 years down the road say, well, all of this started during my labor, like when I had my kids, because we hear that all the time in the clinic
sure
now.
You do.
Like, this leakage started a little bit after I had my last baby, or this back pain really started during my second pregnancy, or you know what I mean? And they're like, it's never really got better. It's started to get worse. And these people are 40, 50, 60 years old now. So we want more preventative care. We want to be top of mind because we all know exercise is very important. It's very important before even conceiving, but also very important during pregnancy. So we just help moms learn what is best for their body and train them appropriately. We talk about proper, nutrition, the protein you should be getting, labor and delivery positions, ways to reduce your risk of perineal tears. So there's a lot we cover, and we have a checklist. I actually had an eval yesterday for a pregnant mom, and we literally asked the mom, out of all these things, you tell us which ones you want to address and don't want to address.
Okay.
Because some moms are very well educated and they know the labor positions and what they should be doing. Some moms know that they're going to be doing a repeat C-section. Some moms know they are doing the epidural no matter what, and that's fine. We just want to know where they're at, and so we can educate them on what they need to be.
There's what's going to happen, and you prepare for anything because perfectly laid plans
don't always go the way.
Don't always go that way.
Yep.
So you got to prepare them in case. Well, in case this happens, well, you may have to deal with that.
Yes, and you never know if a emergency C-section that is needed has to be done, and that can sometimes throw mom's plans completely out the door. But we want a healthy baby and healthy mom. So
Yeah,
That's what it's
there you
all
go.
about,
Yeah.
no doubt. So you've been doing quite a few women who've been in. Do you get to? If you see women before or while they're pregnant, do they usually come back? They've enjoyed the experience being with you and figuring this out. They probably come back for the afterwards as well, right?
Yes, most of them, we always recommend a postpartum rehab. Research also shows that. So research shows if you do postpartum physical therapy after having a baby, it reduces your risk for urinary leakage. It reduces your risk for pelvic organ prolapse when that bladder or uterus starts to kind of fall downwards. And it also improves your sexual function. So we say all women, and research backs it up, should be seeing a pelvic floor physical therapist after having a baby. And in our clinic, we recommend typically at least three to 5 sessions between the 6-week period to the 1 year postpartum. So we definitely recommend all women come back to see us, and all of our pregnant moms, they typically always come back to see us. And then a lot of them come to see us for each pregnancy too.
Oh, which makes sense.
Yes, and now that we have a membership too that we started this year.
It's kind of like the country club for pregnant ladies, right?
Exactly, yes. It's like the cool place to be.
Country club.
Yeah, cool country club for pregnant mamas.
Sipping tea.
So yes, we have a lot of women that are participating in our membership now, which is a year membership. Typically, it can be used however you want to, but typically recommend starting second trimester, 6 months during pregnancy, and then 6 months postpartum.
Okay.
It comes with 8 physical therapy sessions with us. It also comes with free classes quarterly. My 4th trimester postpartum rehab class, which is a 2-hour class. And then coming up on May 4th, which anybody in the community is welcome to attend, is our pregnancy prep class, like birth prep. It is a 4-hour class, 8 to noon. It is $200, but if you are part of our membership, you get that included as part of the membership.
That's part of the deal there.
So we have 11 couples signed up for that. We have 4 spots left. I am capping it at 15 because I want to be more hands-on, one-on-one, and like helping husbands or partners learn how to do different pressure points and things like that. So
Very interesting. When was that class again?
it is coming up on Saturday, May 4th.
All right, so just
It
a
is
couple of
coming
weeks
up.
away. So
Yes.
there you are.
And you can find more information on that on our Facebook page, or just call our office and we can send information over.
Very good.
Good
Yes.
stuff.
And that would be a great, if anybody has baby showers coming up, that would be a great baby shower gift.
That would be.
Sending somebody to that class. Or we've had some moms that have gifted their daughters the membership for a year.
Which is awesome.
Yes. And that's what moms really need. They don't need more baby clothes.
Yeah,
you
they
know
got
what I
all
mean?
that stuff. Yeah, you got all that. Let's get them another toy or something.
Maybe some
Yeah.
diapers, but
Yeah.
then get this.
Yeah, diapers, wipes,
Diapers
and
and class.
some pelvic floor physical therapy.
That'll probably be a very nice thing for them to about, and they'll be like, "That was the best gift he ever gave me because now I'm back to normal and doing what I'm doing."
Feeling good, not peeing your pants, back's not hurting.
That's not a good thing. I had no idea.
Yes.
You know, I was just thinking of this. One more question, Dr. April. You know, is there maybe a thinking that, you know, after you have a baby, and so I wouldn't know, but is there a thinking of, you know, I've got all these, you listed a whole bunch of symptoms there. Do some people tend to think, hey, it's all due to, you know, weight or something like that, and like, that's going to get better over time as some of the weight comes back off after a pregnancy? Is that, do you hear that, or is that like a thing that like, it's just kind of going to get better? You know, maybe it will, maybe it won't. I don't know.
Yes, all the time we hear that.
I bet.
So even our current moms that we're seeing that are pregnant now, they come in and they're like, you know, after my first baby, I thought this was going to get better, and then I had a second baby, and it's still not better.
Oh, yeah.
Or like, I'm pregnant with my second or third, and I'm still having these issues, so it's better. Like, and they're like, I want more kids. It's time to address it. And like I said earlier, our moms are in their 40s, 50s, and 60s. They come in and they're like, you know, I just thought after having babies it would eventually go away, and it never
And it
did.
didn't, huh?
Not
And
quite.
moms are notorious for not taking care of themselves.
Everybody else
They
first.
take care of the rest of the family, and then once the kids are finally, you know, in high school or out of the house, they're like, okay, it's time for me to address this issue.
I'm a wreck. Let's take care of it.
So let's take care of it now so we can show up
Yeah,
the best for
absolutely.
our kids. So, yes.
Yeah, preventative measures are always best. If somebody's interested in what you do and you do great stuff, how do they get a hold of you and get this going?
Easiest way is to call our office, 217-705-5077. But you can also follow us on Facebook, Instagram, go to our website, effinghampelvichealth.com, and you'll find information on there. But the best way is to just give us a call.
Very good. Well, Dr. April, always a pleasure. Have a wonderful day. Enjoy.
Thank you.
It's even brightened up since you've been
Oh,
in here. a little
really?
bit.
Is it still supposed to rain this weekend?
Yes.
Yeah.
Oh, the Effingham garage sales are going on.
Oh, are they really?
Yes, and we're going to have a big one, so I
Oh.
hope it...
Hope you got a garage.
Well, my wife told me, see if you can get this out of the forecast.
I would appreciate it.
I'll do my best. Okay. Very good. Hey, we'll talk to you soon. Have a great day, and good luck on that yard sale.
Thank you.
You want to throw an address out where it's at?
Oh, yes, 902 North Osceola by Community Park. It's multifamily. We'll have 4 families, a lot of baby clothes, kids,
Watch out.
0 to 14.
All right.
Thank you.
Very good. I thought you're paying for the time. Get it all right.
Very true.
Good
Thank you.
deal.
All
Good
right. No
deal.
problem. Hey, we'll talk to you soon.